Hi, my name is Ebony Bassett. I'm a current Master of Public Health student at Liberty University, concentrating in health promotion. This is HLTH698, the Practicum project experience. I chose to evaluate the satisfaction and epidemiologic workforce capacity within the Chickahominy Health District in Ashland, Virginia, with their COVID-19 disease containment team. Employee job satisfaction is crucial to the quality of service or care employees are able to provide in healthcare and public health services. Improving job satisfaction will include improve quality of care, improve workforce capacity, which also includes the improvement of COVID-19 mitigation strategies and hopefully decrease turnover rates in workplaces. The Chickahominy Health District has not assessed its COVID-19 disease containment team in over a year. So in this project, my preceptor and I sought to develop an assessment tool to evaluate the disease containment team's workforce capacity as well as their job satisfaction. The Chickahominy Health District serves Charles City, Hanover, Goochland, and New Kent counties, all within the Commonwealth of Virginia. The mission of this health district is to improve community health through prevention of disease, promotion of healthy lifestyle, and protection against environmental and other hazards. Phase one of the Practicum project was to prepare. In this, we conducted a literature review of data surrounding factors of satisfaction of employees in healthcare and workforce capacity assessments using peer-reviewed journals. We were required to review types of questions asked by surveys of employees to gauge dissatisfaction. We also needed to obtain data demonstrating relationships between employee satisfaction and quality of care provided through reviewed of peer-reviewed journals. This led to the development of the first objective, where we conduct a systematic literature review of relevant resources to develop an assessment tool to facilitate an evaluation of employee satisfaction and capacity to implement public health strategy, in this case, among the COVID-19 disease containment team at Chickahominy Health District in Ashland, Virginia. This was measured by the total number of articles retrieved during application of the literature search strategy designed to facilitate the conduct of a systematic review and relevant peer-reviewed scholarly resources. Phase two of the Practicum project was to develop the assessment tool. And here we needed to identify the key factors in healthcare employee dissatisfaction through the review of the peer-reviewed journals on satisfaction in employees in healthcare. So we identified the type of questions to ask during the employee satisfaction survey. And these included the training processes, skills, and then overall job satisfaction, which included role changes, promotions, any team changes like significant layoffs or significant onboarding of a lot of new employees can also, increase some anxieties in the team, efficacy of communication among the team, some psychological stressors that could happen. The COVID-19 pandemic did increase a lot of anxieties. There was a lot of uncertainty in the beginning of the pandemic. In phase two, we also wanted to validate the questions that we had chosen through palette testing to determine the comprehensibility of these questions and predict the yield result. And then after the pilot testing, we were able to go ahead and develop the survey using Google Forms. Google Forms is an invaluable resource as the responses to the form are automatically generated into Google Sheets, and then the further analysis of data took place in Google Sheets without having to convert to different formats such as CSV or XLS, because they're all Google systems, as well as the emails being sent through Google Gmail. Following the pilot study, we did recognize the importance of a free response or a short answer format at the end of the survey to allow employees to express things that they felt weren't covered in the rest of the 56 questions we were able to develop. The 6 constructs of the social cognitive theory that were used to assess and evaluate job satisfaction and epidemiologic workforce capacity were reciprocal determinism, behavioral capacity, observational learning, reinforcements, expectations, and self-efficacy. This was important because we want to evaluate the relationship between person, environment, and behavior, otherwise known as the reciprocal triadic causation. In this evaluation, we also considered the essential public health services in epidemiologic capacity There are 10 essential public health services. We chose to focus on 1, 2, 9, and 10, which seem to be the most effective in evaluating workforce capacity. So those are 1, monitoring health status to identify and solve community health problems. 2, diagnosing and investigating community health problems and health hazards. 9, evaluating effectiveness, accessibility, and quality of personal and population-built health services. And 10, conducting research for new insights and innovative solutions to health problems. So these do encompass a lot of what the Chickahominy Health Department COVID-19 disease containment team does on a regular basis. But in order to truly assess it, we had to go back and evaluate what are the CDC's 10 essential public health services. The 5-point Likert scale was used as it is an adequate way to measure employees' attitudes and opinions towards given topics. My preceptor and I developed the 55 5-point Likert scale questions, and we evaluated them with the pilot study focus group that consisted of 3 individuals. We were able to distribute invitations to the employment satisfaction and capacity survey throughout the Chickahominy Health District COVID-19 disease containment team, which did consist of 21 persons at the time. We initially started with 27 persons, but due to changes in the COVID-19 mitigation models as dictated by federal public health guidance as well as the Virginia Department of Public Health, we did lose some members, and then 15 of those 21 persons did complete surveys in their entirety. Employees answered favorably when asked. I often have to learn new systems and equipment on my own. This was followed by the organization supplied me with sufficient equipment to perform my daily duties, where 100% of participants responded favorably as well. So to receiving adequate supplies to perform daily duties, they did reply agree or strongly agree. So that confirmed that participants did feel they were given the resources to do their jobs well. They did answer favorably for I often have to learn to use new systems and equipment on my own, and we did want them to answer negatively, which was strongly disagree or disagree, which confirms that they did receive adequate training, or at least they felt as though they received adequate training on how to use the systems provided to them. Concern for employees was the sense of connectedness that they felt. They did respond positively to this, answering strongly agree or agree, but team members did respond less positively with less strongly agree answers when asked, I feel connected to my teammates. This could be related to changes in the workplace following the COVID-19 pandemic. A lot of our employees do work remotely. Almost all of our department work. Throughout this Practicum project, we were able to evaluate the Chickahominy Health District's COVID-19 disease containment team's job satisfaction as well as epidemiologic workforce capacity. We recognize the ways in which the COVID-19 pandemic has affected healthcare employees as well as public health professionals. Employees have experienced burnout, compassion fatigue, and an overall diminished professional quality of life. The COVID-19 pandemic has also affected the mental and physical well-being of these healthcare providers as well as public health professionals as well. The beginning stages of the pandemic increased some anxieties surrounding work. This put a strain on health departments as well as hospital systems who were already struggling. As previously stated, there was already a lack of professionals in these environments, and the COVID-19 pandemic created less individuals available to work for a variety of reasons. The assessment that we did during this Practicum project just allowed us to evaluate the workforce capacity and employee satisfaction in these factors that were affecting their ability to work as well as their satisfaction, with the intent of improving retention and the quality of public health services provided. This assessment tool developed during the Practicum experience will aid the Chickahominy Health Department in these retention practices. Additionally, I do feel like we should have included a Middle Eastern and North African descent in our ethnicities for demographics. If we're dealing with employee connectedness, then we do want to make sure that all of our employees are represented fairly in all of our answer choices for the survey. That was something I feel like I severely overlooked, especially if we want employees to feel recognized and supported by their organization when they are not working face-to-face with all individuals. For the ethnicity, we did include Latino Hispanic, which of course does allow people to choose their race as well as their ethnicity, but we did omit the Middle East and North African, which in most cases people will respond other or white, but that is not a fair representation of those groups. Also, another weakness that we had was just the sample size. Of course, that is the size of our department, and we did lose a lot of people, but 21 persons, it's kind of hard to apply that to a wider range of individuals. Now, for our team, that is beneficial, the size, because we can address certain things without anyone feeling called out, but we can't address these things because there are so few of us. That is something that we'd be able to do. And as I say, this overall practicum project has been a great experience, a great way to definitely apply the things we've learned in our public health journey at Liberty. This was a way, of course, as a case investigator, we do apply a lot of like the epidemiologic, like research and collection of data, but to actually be able to apply the things that we've learned in a more detailed way, this has been an amazing experience. And I couldn't be more thankful for my preceptor, Michelle Rogers. She's also my manager. And just as a manager and as a preceptor, she's just been full of advice and ways to keep me grounded, as well as give me guidance on how to make this project better, how to be a better case investigator and a public health professional in the future.